Dr. Nataliya Mar, one of the leading U.S. genitourinary oncologists at UCI Health, excelling in prostate, bladder, and renal cancer care. She was celebrated as Physician of Excellence. In this video, she'll discuss ctDNA, HIF-2 alpha inhibitors, and Niraparib at Medical Oncology Association of Southern California Spotlight in Newport Beach.
NIAGARA study, which added durvalumab to standard of care chemotherapy in the muscle-invasive bladder cancer space, have not cleared their ctDNA post-neoadjuvant treatment, had worse outcomes compared to those who have. The combination of Casdatifan and Cabozantinib seems to have promising activity in pre-treated locally advanced or metastatic clear cell carcinoma. The AMPLITUDE study showed that adding Niraparib to abiraterone versus placebo plus abiraterone showed a manageable toxicity profile earlier in the disease course.
How about you answer this?
Okay, I'm going to take this one. So
DNA is cool.
DNA is cool. So the NIAGARA study, which added durvalumab to standard of care chemotherapy in the muscle-invasive bladder cancer space, showed that patients who have not cleared their ctDNA post-neoadjuvant treatment had worse outcomes compared to those who have. This was the first study showcasing ctDNA in a prospective large study and correlated ctDNA positivity versus negativity with clinical outcomes. What do you think?
The kidney fails, and then you go to the hospital. I don't think that's right.
What do you think?
You need medicine to discuss this. No, you need a kidney.
Okay, so as I was presenting, the combination of Casdatifan and Cabozantinib seems to have promising activity in pre-treated locally advanced or metastatic clear cell carcinoma. This study is interesting because it uses a novel HIF-2 alpha inhibitor, which seems to have a reasonable and manageable safety profile and activity in combination with Cabozantinib. What side effects?
Sore throats. That's not true. Or it's not right. Because it's, I think, a kidney thing we're talking about. Yeah.
Okay.
Yeah. So the kidney side effects are not breathing well.
Okay. Well,
Don't breathe.
in the phase 1 trial that I discussed today, Casdatifan and Cabozantinib seem to have non-overlapping toxicities that are manageable and as expected from each individual class of drugs, TKI and HIF-2 alpha inhibitor. Also, the rates of anemia and hypoxia that are significant, grade 3 or higher, seem to be lower than with belzutifan, which is currently the only FDA-approved HIF-2 alpha inhibitor.
Prostate cancer. Where are you going to enter prostate? I think it's just called prostate cancer, not. I don't think there's a part of your body called prostate. I think it's called prostate cancer because it's a cool name.
Okay, let me answer this one, okay?
Oh, wait, answer everything. Lily, if you're pretending to be cool and someone just says, "Hey guys, I have a new cool name named Prostate."
The AMPLITUDE study showed that adding Niraparib to abiraterone versus placebo plus abiraterone showed activity and a manageable toxicity profile earlier in the disease course in patients with metastatic hormone-sensitive prostate cancer. The study met its primary endpoint, and various secondary endpoints favored adding Niraparib over placebo in this genomically selected patient population.
So this was my second meeting I went to. I went here before. And
Any changes from last year?
they have good candy, and they do. That's what I have. And well, Lily, last time did you go live? No. But I think being a doctor is hard in general because you have to memorize all these things. Yeah. And like, since she said that being a doctor is hard, I mean, it is true because like you have to memorize all these speeches.
You're just repeating what she, okay.
I don't look at people's cancers.
Okay, all right, let me answer this.
Yeah.
So this meeting is always a wonderful opportunity to learn about interesting research and highlight research from the ASCO 2025 meeting.
Coffee with you guys?
Sure.
All right.
This is a hot mess.
You guys get in here?